Welcome back, everybody. Again, we're here with Dr. Marie Walker from the Rockford Spine Center. Now, we want to talk a little bit about how you know when you should actually go to a doctor, because you were talking before about painkillers, ice, stuff like that you can use on your back, but sometimes those things are not enough.
Right, and I think if, like we were saying before, most back pain does resolve on its own. So if it doesn't resolve within a few weeks and it's significantly affecting your daily activities, probably should get it checked out by a doctor.
You were saying before the break, too, that almost always you don't need surgery. And I would imagine
right.
some people are scared to call because they don't want to be told, oh, yeah, we can operate on that.
Exactly.
You know?
People they're fearful that they're going to be told they have to have surgery. And yes, the vast majority of back pain does not need surgery. There are, yes, a lot of other things that you can do for pain relief.
So you really don't need to be scared about it.
Right.
Okay. Now, you're talking here a little bit about back pain that follows trauma. Mm-hmm. So, for example, if you get hurt playing sports, or what would that be?
Yeah, that could be a significant fall, a motor vehicle accident, something where an event happens and you have pain right away that's pretty severe. And that probably needs to be looked at right away. You don't want to wait on that one.
Okay, because you were talking before about like seeing if it goes away on its own, but not in that case. If you know something caused it, yes. Something's not right. All right, and then things that are not relieved with like over-the-counter medicines too.
Right. Yeah. If you try all those things and they're not getting better within a few weeks, then you should probably see a doctor. Also, if you're having other associated symptoms like fevers, chills, weight loss, it might be something more serious. If you're having any leg pain, numbness, tingling, weakness, that's obviously a sign that maybe the nerves in the back are affected, and that needs to be looked at by a doctor as well.
Now, weight loss, that's an interesting one. What would weight loss have to do with your spine?
That's in the rare cases where it could be cancer, especially if you have a history of cancer. The cancers that tend to go to the spine are breast, lung, thyroid, kidney, and prostate.
Gotcha. Okay, so that's very important to get checked out right away if you notice that you're losing weight for no apparent reason. And then you talk about, I don't even know if I'm going to say it right, sciatica? Is that right? What exactly is that?
Yeah, a lot of people call the leg pain that they get periodically sciatica, and it's usually caused by a pinched nerve in the back. Okay. The things that can pinch a nerve in the back is either a disc herniation or arthritis.
Okay, both things that you were talking about before as being like common causes. So you're saying it shows up as pain in the leg then?
If it's a significant, because some disc herniations don't cause leg pain, and some arthritis, a lot of arthritis doesn't pinch nerves. But if it is a significant, large enough bony spur from arthritis or a large enough disc herniation, it can pinch a nerve. Okay. And then you can get leg pain, and that's usually a pretty awful pain to have nerve pain down the leg, and people usually seek a doctor just because the pain is pretty bad.
Well, I can imagine that in a case like that, or any time when you have pain that's bad enough that it's actually interfering with your life, that little light bulb goes off like, okay, I need to go see a doctor now. Yeah, but for people who are still able to get by day to day, a lot of times it's easy to kind of push that off.
Right, and honestly, most pinched nerves or sciatica can come and go. You know, you have good days, bad days. If it doesn't significantly affect your quality of life, you're probably fine to wait that out as well. But if it's severe, it needs to be.
So it can come and go. So just because you have some good days in there, it doesn't necessarily mean that you're fine.
Right. Yep. Okay. It can come back. And so a lot of it depends on, how bad is it bothering you is what we ask people, because we can treat it as aggressively as you want us to, essentially.
Right. All right. Well, that's a good segue, because we want to talk about some of the things that you do in your office. You're here with the Rockford Spine Center. rockfordspine.com is the website. And there are so many different treatments that people can have for some of these different problems. So what are some of the most common treatments that you will address back pain with?
Yes, well, first of all, when I see a patient, I'm going to do a full physical exam and do some x-rays and possibly some advanced imaging, an MRI or a CT scan, just to get more clinical information about what's causing their specific pain. And then a lot of times we try either physical therapy, some prescription medications. Occasionally I'll try some bracing, and injections. There's a lot of different types of injections, either into the muscle or the joint, or into the epidural space where the nerves live if it's a nerve problem.
So there are a lot of different options, and I noticed none of what you said was surgery, so there are lots of other ways to tackle it.
Right, that's probably the last resort. And honestly, if you're complaining of mostly back pain, we almost never offer surgery because it doesn't help.
Okay.
It's more for the leg symptoms, neurologic symptoms that surgery is better at fixing.
Well, that's good to know. So what are some of the physical therapy approaches that you would take then?
Yeah, so in my evaluation, you figure out what muscles are tight, what muscles are weak, and we try to stretch the muscles that are tight and strengthen the muscles that are weak. It's that simple.
Is it something where people can learn the moves and then go do them at home?
Absolutely, that's the goal, the ultimate goal, and there's just a lot of education, and a lot of people are afraid to start a program. They're afraid they're going to make their back worse. So under the guidance of a physical therapist, you can really get a custom program for you.
Okay, how does what you do at the Spine Center differ from, say, a chiropractor?
Well, a chiropractor focuses a lot on joint mobility. So they're going to do a lot of mobilization of the joints. They also do a lot of modalities for temporary pain relief. I mean, there's really mostly contrast between a physical therapist and a chiropractor.
Gotcha.
The physical therapist will work more with the muscles.
Okay.
They can actually mobilize the joints in the back too, but chiropractor focuses more on the joints, and then the physical therapist oftentimes focuses more on the muscle.
Well, and you did say that muscle is the #1 cause of back pain. So in the majority of cases, that might be the way to go then.
Right, and you can argue that the joints are out of alignment, and if you adjust them, that'll help the muscles to relax, and vice versa. If the muscles are spasming, they're going to pull the joints out of whack. But they're both good. I definitely have told some of my patients that chiropractic care may be appropriate for them too.
Okay, so it's not like you're going to keep somebody from that if you feel like that would be the better route.
I'll say that there's no contraindication for it, and that specifically if it's a joint problem, I think that chiropractic care is very appropriate.
Great. Now, if somebody comes into your office and they're getting physical therapy or whatever, do you also go over with them what they can do on their own to prevent more back problems in the future?
Yes, absolutely.
Okay. What are some of the tips that you give people? Because these are probably tips that the rest of us could be using also. Right.
Well, it's probably a combination of lifting techniques and how you lift things, and being conscious, using your legs more, proper alignment of your spine, and then ergonomics, either in the workplace or while they're cleaning their house. It's you just certain positioning of your back that's going to put it at a mechanical advantage.
I would never have thought of that for cleaning. Like cleaning, you just get in and get out as fast as you can do it. I never would have thought of
like in the bent forward position, vacuuming under things, and that can aggravate the back.
Well, it's so funny too with lifting. I always remember there's the rule: lift with your and not with your and I can never remember which one goes in which place. So I'm like, lift with my back. No, lift with my legs. And I can like, how do you keep that straight?
Well, it's better to lift with your legs. You're a lot less likely to injure your legs than your back.
That's what it's hard to remember. Okay, so just let your back not be the one that's doing all the work. Right. And then you talk also too about like confirming a diagnosis. Do you have people who come in and they say, I think this is the problem, and how accurate are they? Yeah,
sometimes they've been told they have degenerative disc disease, and they have these different things because they've probably had advanced imaging by the time they see me, because I'm a spine specialist, and they'll say that they've got these problems and this is why they have back pain, but it's not necessarily the cause of their specific back pain. In fact, degenerative disc disease is I sometimes tell patients it's no more of a diagnosis than wrinkles.
Really?
Because it's usually not the pain generator.
Okay, it's just an effect.
It's all of our discs kind of dehydrate with time.
Gotcha. Oh, that's very interesting. All right, we are out of time. If people want more information about what you do at your clinic or just in general, the website that you want to go to is rockfordspine.com. Again, that's rockfordspine.com. And Dr. Walker, where are you located?
On McFarland Road, 2902 McFarland Road.
That was the hardest question of the day.
I'm sorry.
All right, great. We'll have this information for you again when we come back. We'll be right back.
Okay.